This is a CT that's showing EDH, where the patient is having typical lenticular shaped hematoma. So, this is a image that's showing acute STH. So, acute STH, where we will see the concave or convex shaped hyperdense lesion in the image. So, this is a diffuse hypodense concave convex image which shows a chronic subdural hematoma. So, this patient is having bilateral chronic subdural hematoma, where the right side is chronic, completely chronic, because there is complete of hypodense, wherever in the left side the patient is having some acute component also, hyperdense lesion also suffered. The patient is having acute and chronic STH on left side and right side the chronic STH. These are the vicious cycle of ICP, raised ICP, which will cause reduced brain CPP, which will again cause secondary brain injury. The secondary brain injury will cause raised ICP. So, these are various measures of controls of ICP. The key parameters to keep in head injury patient in neuro ICU. The MAP should be 80 to 90, ICP should be less than 20, and CPP should be more than 60. So, these are the recommendations given by the Brain Trauma Foundation for the traumatic brain injury patients. Use hyperosmolar therapy like mannitol and prophylactic hypothermia and infection prophylaxis, and ICP monitoring is indicated when the GCSE score is 3 to 8 on admission and abnormal CT. But in case of severe traumatic brain injury with a normal CT patients, the ICP monitoring is indicated with 2 or more of the following, like age more than 40, unilateral posturing, and hypotension with the systemic blood pressure less than 90 millimeter of mercury. So, these are the patient need ICP monitoring. So, brain oxygen monitoring and thresholds, wherever the patient needs a CPP threshold, the CPP should be less than 50 millimeter of mercury, okay, and the aggressive intervention to maintain it above 70 have considered risk of ARDS. Okay. So, there is a threshold for the CPP, and the brain oxygen monitoring is needed whenever there says jugular venous pressure is 50 or above. Okay. So, you have to maintain the jugular venous saturation to be 50% or above. Okay. So, you have to maintain the blood pressure, and the nutrition should be started at least day 5 and at most day 7 post injury. So, in 5th day you have to start nutrition, at least 5th day. So, sedative. So, high dose barbiturates they are recommended. Okay. So, propofol recommended for ICP control, but it does not improve the mortality. So, seizure prophylaxis, okay, it not recommend to is decreases the early onset seizure, okay, early post traumatic seizures, but it is less than 7 days after the injury, but there is insufficient evidence to recommend levetiracetam over phenytoin. Okay. So, we can give phenytoin also as a initial drugs. So, the giving levetiracetam superior to the phenytoin is not evident, and hyperventilation as a temporizing measures and steroids is contraindicated.